We're seeing a lot of exciting developments within the healthcare field with regard to patient engagement and interoperability. So, for example, patients being able to access their health data, but also being able to actually construct longitudinal records, being able to piece together various data from various different sources. And if you're someone who suffers from a chronic condition, or perhaps you have been receiving care over many different providers and different kind of episodes in your life, you may need to have that data all in one consolidated place, or have easy access to that data in order to shore future providers and take a much more involved approach to your own care. So we've seen that helps patient outcomes as well.
And from a FHIR perspective, I think it's important to note that there have been multiple efforts in the past with regards to interoperability within healthcare. So we've seen things like HL7 from an insurance or a health plan perspective. We've seen X12, which I genuinely have a dislike for as far as interoperability goes. Not for any other reason other than that the standards that were being used, while they made sense from a healthcare specific domain perspective, they didn't really allow a ease of transfer, because you had to have very, very specialized technology with which to operate with. And HL7 and X12 are two very, very good examples of that. And FHIR, one of the big things for me as far as driving that patient engagement and then ultimately patient outcomes is the ease with which different technology vendors can process that particular information. So like Daniel spoke about before, it was only relatively recently from a technology perspective that hospitals, clinics started adopting EMRs. Now, prior to that, if you wanted your health information to be available to the next specialist that you were at, or a number of specialists that you now have to see for whatever multifaceted problem that you had, it was quite a big lift and quite a manual lift to have to do all of those things individually.